Good evening. Welcome to Aging with Attitude. My name is Phil Koch. I'll be your host this evening. And tonight we have a special guest, Jeanie Schepisi, and she is with SHIP. And SHIP, Jeanie has been kind enough to come back on the show. She's been on the show a few times now. And why don't we talk first a little bit about who is SHIP and what does SHIP do?
Okay, hi Phil, thank you.
Yeah.
SHIP stands for the Seniors Health Insurance Information Program. So I'll tell people it's like a boat, but it has two eyes in it. And basically we are North Carolina's state health insurance assistance program. Every state has a state health insurance assistance program, and the goal of the state health insurance assistance program is to help people that are on or going on Medicare with their Medicare choices and their options and their decision making. We are neutral, objective, and unbiased. Our services are provided at no cost. Our program was created in 1986, and we were the second program like ours in the country. We are a division of the Department of Insurance, so we're a state agency. And in 1992, the federal government realized what we've been doing for 6 years, and they mandated on a federal level that every state in the country have a program like ours. So they used our program as the model to create SHIPs in other states. So as of 1992, there is a SHIP or a program that helps people with Medicare questions in every state.
Wow, so North Carolina kind of led this in the
Pretty
nation.
impressive, yes sir.
Wow.
And we are progressive. We were the first state to have web-based training for our volunteers that started a few years ago. We probably had the most SHIP volunteers in the state compared to other states. And we actually have not only an office in Raleigh because we're a state agency through the Department of Insurance, but the beautiful thing about our program is if people need local one-on-one assistance, there is an agency, at least one agency in every county that acts as the SHIP coordinating site. So a person can go locally and get that one-on-one assistance, again, at no cost to them.
And it's very important information. You've been on the show before, but for those viewers that haven't been here, they can sit down, discuss Medicare options and insurance issues with a counselor, right?
Exactly. And our goal is to make sure that the person that meets with us is getting the best insurance product for them, because we realize everyone has different scenarios and situations, and everybody can afford different things because people are at different income and resource amounts, but that person gets the best plan for them at the least amount of money. That's our goal.
Right. Now, for our general vicinity of Charlotte, there's the counselors are who and where are they located?
That's a great question. We actually are fortunate enough, Mecklenburg is one of the counties that's large with a lot of people, so we actually have two coordinating sites, and that's the Tyvola Road Senior Center, which is on Tyvola Road. Jennifer and Carrie are our SHIP coordinators based there, and they actually compare a client up with a volunteer counselor in any area of the county because there are other senior centers that connect with the Tyvola Road Senior Center. Right. And then the Shepherd Center, which is at Trinity Presbyterian Church on Providence. Nina is our SHIP coordinator there. So we've got two really strong agencies and really strong ladies that can screen that client, find out what they need, pair them with a volunteer counselor. We've got about 50-some volunteer counselors in Mecklenburg. So out of probably all the counties in North Carolina, we have the most volunteers here in Mecklenburg County, which is great for the clients that need to be served.
So 50 different counselors that can help people individually at two physical locations.
Exactly. So it makes it accessible for that client no matter what part of the county they're in. And we do have some clients that border adjoining counties that may be more convenient for them to go to another county, but you can call the SHIP office in Raleigh or you can visit our website to find out who the coordinating site is in your county.
So every county has a SHIP coordinator?
Yes.
So for those viewers that are perhaps outside of Mecklenburg County and can't get into the city to one of the two locations, reach out to the SHIP website or a counselor and call and find out where your closest office or counselor would be, right?
And we also get calls, my Mecklenburg County and my Union County volunteers say we're right on the border of South Carolina, so they occasionally get calls from people in South Carolina. And Medicare pretty much is a general thing, no matter where you are, countywide or statewide, but we can help that person, and if they need specific information from South Carolina, we can give them the SHIP number in South Carolina, and that's actually on our website as well, the SHIPs in other states, in case a person does have a state-specific question that maybe North Carolina is not equipped to help them answer.
So you can answer questions about Medicare, any other types of insurance. What about Medicaid?
We are not the expert on Medicaid field, but we can answer basic or general questions about Medicaid and get that person started. And then if there's a question that we are asked, we always tell our volunteers, if you don't feel comfortable with something, there's a fine line. You don't cross that line. And so we can help maybe to a certain point, but then refer persons to the local county departments of social services because they're the experts on Medicaid.
Right.
And we partner with the departments of social services and Social Security so that we can help our clients better and to give them an appropriate referral, not the runaround.
Gotcha. What are the more common questions your counselors would get, you think?
Well,
in general?
It's interesting because when our program was created in 1986, we had people asking questions about a supplement policy because pretty much original Medicare A and B and supplements were all that were around at that time.
Right.
And as time has passed, we find that people are asking questions about Medicare Advantage plans
Right.
or managed care plans under Medicare, which are like your HMOs and PPOs, because they have become available over the past few years and people are curious about what they are and if they're a good candidate for that type of product. Mm-hmm. In 2006, Medicare Part D or the prescription drug benefit started. So that's a lot of what we answer questions about now is what's the best Medicare drug plan for me and when can I change and what if I don't take a plan out. So a lot of the focus in the past few years has been on Medicare Part D or the prescription drug coverage. We also get people who are, because of the baby boomers, who are asking, I'm going on Medicare, what do I need to do? And so we have a 4-page document that's called the Road to Medicare. It makes it short and to the point, but it helps that person that's transitioning from whatever other types of insurance to Medicare. And so we are getting a lot of questions now from people that are going on Medicare due to age 65 or even due to disability under 65. What do I need to do and when do I need to do it? And we're a really good resource for that. We want people to know about our program before they actually need us.
Right. Yeah, it's good. You know, they need a plan ahead.
Exactly.
Road to Medicare, that sounds great. So anybody who's getting close to that age, which is again
65, unless you're under 65 and you've been qualified for Social Security disability, you have to receive 24 months worth of Social Security disability checks before Medicare kicks in. And I remind people, October is coming up and it's National Disability Awareness Month, and we want to remind people that the S in SHIP stands for seniors, but our goal is to assist any person that's on or going on Medicare regardless of age.
Correct. So that sign up is coming up in October.
The annual election period. You're correct. It's very close around the corner. It seems like just yesterday we were helping people select their 2015 Advantage or drug plans. But from October 15th of this year to December the 7th of this year, we are the agency in North Carolina that receives federal funding to help a person look at what medications are you taking, what pharmacies do you prefer to use, and what plan might be the best for you, cost-wise and product-wise, as far as what plan's going to cover all or most of my medications. And that's very important. It's an exciting time of the year. Our volunteers are getting ready to help a lot of people. The more we help people, the more they keep coming back, the more they tell their friends, which generates more activity, and that's what we want. And so we're getting ready to train our volunteers to help people for next year's plans. We want people, regardless of if they take medicines or not, to have a Medicare drug plan of some sort. We want people to compare those plans every year because your medications may have changed throughout the year and the plans change from year to year. So there's a few things that we remind people of. First of all, in a few months, you're going to go to your mailbox and get Medicare and You 2016. That is your owner's manual if you're on Medicare. And while I don't encourage a person to sit down and read it all at one sitting, that would make for some good snooze material. You can break it down. You can look at the index near the beginning of the book and look at alphabetic listings of things that might be of interest to you or that you're looking for. So be on the lookout for Medicare and You 2016 coming soon to a mailbox near you.
Right.
If you're in a Medicare Advantage plan or a prescription drug plan this year, the company is required by law to send you a letter telling you about your benefits under that plan for next year. And there's 2 ways to go with that. You may get a letter saying, thank you for your business. We're going to be around next year, and here are your plan changes. Some people don't look at those letters, and so they don't do anything. The AEP passes and that door closes, and January 1st gets here, and they go to their pharmacy and they refill their prescription, and it's not what it was last year. It's more expensive. And had they looked at that letter, they would have found out that maybe there was a formulary change or maybe a non-coverage of that medicine for the next year. At that point, for most people, it's too late to make that change. So that's why we encourage people to open that letter and look at it to see if your plan's going to be around and what that annual notice of change tells you. Another situation is you get your letter from the company that you're in now, Advantage or Part D, and they're not renewing their contract, and that's what we call a Dear John letter. And that letter says, thank you for your business this year, but we're not going to be around next year, and you need to make some decisions. And if you don't, here's what's going to happen. Again, a person doesn't look at that letter. January 1st, they go to the pharmacy, and they don't have the plan in 2016 that they had in 2015. And in most cases, that person cannot make a change because that AEP door has closed. We don't want that to happen to people. We want them to come to us or call us and let us help them decide what's going to be best for next year.
Yeah, so the letter is a good starting point. Be on the lookout for the letter.
Yes.
Will it be addressed, ship, or?
It will actually have the company, like if they're in a certain plan,
Gotcha.
that
Okay.
company's logo will be on the outside of the letter identifying who they are. And I tell people, I know when you get ready to go on Medicare, you get a lot of fan mail, we call it. And some of that is legitimate, some is not, some's helpful, some's not. And I tell people to look at that envelope, and if you can identify whom that's from the outside of the envelope, that's great. But if not, open it up. You need to open it up anyway, but open it up. And if you read whatever is in that envelope and you can tell who it's from, and if there's a number for you to call if you have questions, it's pretty legitimate. Otherwise, you should recycle it, trash it, just disregard it, because if it's an agency that's legitimate, they're going to want you to know who they are and how to contact them with questions. So yes, at the end of September, the 1st of October, every person that has a Medicare Advantage plan or Part D drug plan this year should get an annual notice of change or a non-renewal letter telling them what's going to happen for next year.
And just, on that note of no emails will come from, yes, because we get a lot of that from seniors.
Right.
They get emails and they say, you need to pay this amount of money
Right.
to learn more about this, and no emails will be coming from, is that correct?
Not to my knowledge. It should be a direct mailer through the U.S. Postal Service at the address that you normally get your Medicare mailings. And then that's another point to bring up. Your Medicare New Handbook is going to come out probably after that annual notice of change or the non-renewal letter. If you retired and you're fortunate enough to have a group health plan with medical and drug coverage, they're also required by law to send you a letter of creditable coverage around that same time. So you should get a mailing telling you how your retirement plan for medical and drug benefits are going to be for next year. Again, if you get that, it's the government, it's a plan, and sometimes that's confusing for people or they don't understand. If you have questions, look at the number on the letter and call. Don't just do nothing and stick your head in the sand and pretend it's going to go away, because that could be very harmful to you for the next year.
Right, so look for the letter. If you get the letter, you don't get the letter, you have further questions, contact the SHIP office.
Yes, we can help you.
Yeah.
If you have the letter, you can read it to us over the phone. We answer our phones in Raleigh Monday through Friday, 8 a.m. to 5 p.m., and there are paid trained staff members that do that. And if you're local, then you could schedule an appointment to meet with a SHIP volunteer, bring any and all paperwork, and they can look at that and help you figure out what's going on and what maybe you need to do.
Right, so again, in the Mecklenburg County, Tivolo Senior Center and the Shepherd Center, which are on east and west side of Charlotte.
Sure,
It's great.
sure.
Great location. Well, great. Wow.
And we've got some great volunteers in Mecklenburg County. I have 20 counties that I manage in my Piedmont region. And of course, Mecklenburg is a larger county, so we tend to have more volunteers here scattered throughout different areas of the county, but they're very knowledgeable and they're very inquisitive. So a person that lives here in Mecklenburg County is in good hands.
Oh. So tell us about the outpatient prescription medications and how you sign up for that. a little bit on that already. But.
That is known as Medicare Part D, or the prescription drug benefit.
Okay.
Because what happened, Phil, when Medicare started A and B original in 1966, if you received a prescription and you went to your local pharmacist, or if you were at the hospital but you were not admitted, you were an outpatient,
right,
your medications would not be covered under Medicare. You had to pay out of your pocket. Some people could do that comfortably, but maybe they prefer not to do that. They'd rather spend their money on something else. Some people could not comfortably afford to do that, and they sort of had a hard time paying for medications, or they were deciding, should I heat my home, or should I buy my medicines, or should I eat, or should I buy my medications? And so the government, Congress, who controls Medicare, said, we want to have a prescription drug benefit, and that started in 2006. So now, as of 2006, if you receive a medication, a prescription medication as of 2006, then that would be covered under Medicare Part D, where it wasn't covered for 40 years under Medicare at all.
Let me ask you something. So we had somebody on a couple weeks ago that were talking about Social Security in general, and how the Social Security date for each individual is based on their birth date, on when you could enroll, and that it was changing as the baby boomers get older. It was moving from 65 to 67, et cetera, et cetera. Medicare, that is not the case, correct?
Correct.
Okay.
I think what you're referring to, and I don't know about you, but people say to me all the time, is Medicare going to be around? Is Social Security going to be around?
Yeah.
And I try to put them at ease to say that there are actuaries at a government level trying to shuffle things to make sure that Medicare, which is a federally funded health insurance program for those people 65 and older and under 65 with a disability who receive Social Security benefits, they want that to be around for years and years to come. They want Social Security to be around. So what they did a few years ago was to say the earliest that a person can retire and draw usually is 62, and that hasn't changed, but it's a partial benefit.
Right.
It used to be that your full retirement age was 65. Well, they bumped that up to 67, and we hear that they're going to maybe bump that up to 70. So what they're trying to do is shuffle or juggle things so that both Medicare and Social Security are preserved and protected, and that they're around for years and years to come.
Correct.
So there may be some significant changes, but right now Medicare is still for those people that are 65 and older and under 65 receiving Social Security disability for 24 months.
So unlike Social Security, which as you already said, probably full benefit from 65 to 67, Medicare
is still 65.
Is still 65.
That's
There's
correct.
no current
That is
changes
correct.
that we know of.
Now, we have heard that they are looking at doing away with the 24-month waiting period for those people under 65 with a disability, and we've heard that for a few years. Until we get something official from the government in writing, we might mention it, but it is not something that's happening right now. We don't speculate, we just say they've talked about it, and if we find out that it's true, then we'll let you know. But again, the government, people should rest assured that the government knows that Social Security and Medicare are two very important programs that assist a lot of people, and they're doing what they can to make sure that they are around for years and years to come.
And Medicare is federally funded and federally controlled program.
It is.
Do the states, individual states, have any say in the individual Medicare programs by state?
Not necessarily. There are some states, and I worked for Medicare before I came to SHIP. Medicare A and B, or original Medicare, are pretty much the same from state to state. There used to be some variance in local policies for certain procedures, and that is based on findings and statistics and data. But for the most part, Medicare is the same from state to state.
Okay.
And Medicare's cousin, Medicaid, is under the umbrella of the Centers for Medicare and Medicaid Services. It's a federally funded program, but it's administered on a statewide level through our Division of Medical Assistance in Raleigh.
Okay.
And then every county has a Department of Social Services that plays a big part in the Medicaid arena, if you will. So I tell people Medicare and Medicaid are cousins. The only difference is, or the big difference is, Medicare really doesn't look at your money, whereas Medicaid looks at your income and resources to qualify for eligibility.
Correct. Very good, very good. So what about other insurances? Is it something that your volunteers can also discuss, like TRICARE, you hear a lot about for the vets in the world?
Sure.
Long-term care insurance, which is privately paid for. Is that something that the volunteers can also discuss and coordinate with the family?
Yes, and thank you for asking that question. If you go to our website, which is www.ncship.com, and pull it up. Down the left-hand side is a blue bookmark area, and there's different topics and subjects and tabs. If you click on long-term care, there's information there. And it may even refer you to the NAIC.org website, which is a great website. There's a lot of information about long-term care on the NAIC website. You can click on the New to Medicare tab, and that's where you'll find the Road to Medicare handout that I mentioned earlier. There's a tab for Medicare Advantage, for Medicare Part D. There's an Employer Group Health Plan tab that has information about TRICARE for Life for retired military and their dependents, veterans information, and we even have some state health plan information, which is very important because the state health plan is a large employer group in North Carolina, and they've actually just changed their enrollment periods for the month of October 1 through 31 to be October 15th through November the 18th. So there's sort of a shift in the open enrollment period for state health plan retirees who are Medicare primary, and they're doing some workshops across the state. So we have links on our website for that. So there's a lot of information on our website on that left-hand side, and then there's a helpful resources box on the right that has who's the SHIP coordinator in your county and who are the SHIPs in other states. So there's a lot of good information on our website. I feel that it's pretty user-friendly, but if you get out there and you have a question, our toll-free number, which changed August the 1st of last year, is 855-408-1212. 855-408-1212. You select a language, and then you press 1 for SHIP or Medicare, and our communication specialists are there Monday through Friday, 8 a.m. to 5 p.m. to answer questions.
So you have counselors that can speak Spanish as well?
We do.
Great.
We certainly do.
Wow. That's great information. How often do you get to come around, like on a show like today, and talk about SHIP and the insurance policies?
Not as often as I would like.
Yeah, right.
I've been around for 19 years, so I've been doing this quite a while, and I have 20 counties, including Guilford, Forsyth, and Mecklenburg, so 3 of the largest counties in the state. And it's amazing, Phil. That's a great question because I'll be doing outreach, and I usually ask the people, how many of you have heard of SHIP? And people raise their hands. And I'll say, well, that's good, because if you don't know about us, hopefully you'll leave thinking, oh, there's an agency that can help me or help someone that I know. So it's always good to get people that have never heard of us. But then on the other side of that, I'm like, I've been doing this for 19 years, and our program's been around since '86, so almost, we'll be 29 years this month. And there's people that still don't know about us, and I feel like, well, we've done a lot of outreach.
Yeah.
There's billboards on 85 as I head back to Greensboro. How can people not know about SHIP? But I think it is, you hear about something, whether it's SHIP or something else, and until you need that agency, you don't really give it a thought. And then you're sort of scrounging, oh, what was that agency that I heard about that can help me with Medicare? And so I think that's what a lot of it is people put us out of their mind if they don't need us right then and there. But we have done a lot of outreach since 1986.
Yes, you have.
And helped a lot of people.
Absolutely, and will continue to do so. Can you, if a child, an adult child for a parent is watching this show tonight, can they contact SHIP if they want to ask questions? Or is there a HIPAA issue, or can they contact on behalf of their parent?
That's a great question. Of course, we help a lot of different people. We help providers, doctors' offices, and hospitals that call us asking us questions about certain things. We help beneficiaries themselves. We help people that are going on Medicare. We help caregivers because we realize that maybe their person who's on Medicare can't call, or maybe they can, but they don't feel versed enough to ask certain questions, so or comfortable enough. So yes, we do help caregivers or family members or friends that call us. We don't have claims specific information in our system, Phil, so it's not like we're giving them detailed information about a claim that they just had or a service that they just received, but we can help them with, if they ask us a question and provide information, here's the answer to that question, whether it be for that individual person or in general. So yes, that's a great question. We can help a family member or a caregiver help their loved one. Good. Are there, you touched base a little bit on the Advantage plans. Can you tell us a little bit more about that and the differences between the types? Of course. And just to note that the Advantage plans for 2016, we have not found out the companies and the plans for next year. We will find that out hopefully very shortly because we're getting ready to train our volunteers. We have a tab on our website that has the Advantage plans in North Carolina by county for this year. But Medicare Advantage plans are also Medicare, or they're managed care plans. It is your provider group, your doctors, your hospitals, your labs that team up with an insurance company to provide health care to you, and there's big communication. Sometimes you have to have a referral when you see a specialist from your primary care provider, and that's so that the right hand knows what the left hand's doing. It's a protection for you. And so these plans have been around for several years now. There are people that would benefit from signing up for one of those plans because the premium for Medicare Advantage may be lesser than that of a Medicare supplement. In fact, some of the Medicare Advantage plan premiums are zero, which is very affordable. You can also get a Medicare Advantage plan very easily because the underwriting is very simple. Do you have end-stage renal disease or permanent kidney failure? That's the only question that they ask.
Really?
And if you have anything else, they have to accept you for that plan. So it's affordable and accessible, and if you're relatively healthy, that might be an affordable, accessible option. But here's what we tell people. It doesn't matter how affordable or free it is or accessible it is. If you look on our website and you look at the companies and plans that are available in your county of residence according to your zip code, and you call your providers and find out if they accept that plan that you're looking at, if their answer is no, it is not a good option for you because bottom line, in order for that Medicare Advantage plan to work, your providers have to accept it.
Or you have to move to a different provider. Right?
Or you have to change providers.
Right.
PPOs and HMOs, if I have time to explain that.
Please.
When I train my volunteers, I tell them that an HMO, a health maintenance organization, that's probably what people are most familiar with, is like a circle, a fully drawn in circle. A PPO is a preferred provider organization, and it's a dotted line or broken line circle. An HMO is restricted. It prefers that you stay in that network, and if you go out, it doesn't pay anything. You pay 100%. And sometimes in that HMO, you have to have a referral. So it's very restrictive. A PPO is a dotted line, and they prefer you stay in the network. However, if you go out and see a provider who's not in network, they will pay, but at a lesser level. So a PPO gives you a little bit more flexibility than an HMO does. So if you're looking at managed care plans and your provider doesn't accept that plan, if you keep your provider and go out of network, it may pay.
Oh, that's fantastic.
And we can help you with that. That's a lot of information, but that's what our volunteers and our staff are trained to do.
So reach out to Jeanie, her staff in Raleigh, the volunteers in your particular county. Jeanie, as normal, it's been great to have you on the show. Provide a lot of great information. We thank all of our viewers for watching the show Aging with Attitude. Thank you again, and we look forward to seeing you next time.